And we went down and we were looking at all of this data. And she looked at our Director of Homeland Security and Justice Programs and said, "What are you going to do with that?" And the director said, "I don't know." Marilyn said, "Why?" And so we took this as a needing to go from just a data collection and inventory to actually creating a system and an implementation that would have a legacy that would carry on. Elected officials change, judges change, et cetera, and it really needed to be something that we were going to systemize rather than just have little pieces. I think the biggest thing, Mike, was I think getting the commissioner involved and having a champion at that level, primarily because they touch all the budgets. The one thing that we can do, like Judge Leifman said, I personally don't have much power or authority, but because it says Commissioner Brown's office, when I call people, they pick up the phone. And that really turned out to be very helpful about just convening the right people and getting them in the right rooms and them saying, well, just because we have this and because we have this, we have a system. Well, no, really we don't. When you do that, then you realize that there have to be some investments. Franklin County has made some investments in terms of purchasing computer systems as well as hiring people. But I would say the biggest commitment that we've made is in terms of, as Ron said, putting our egos aside, putting the right people at the table and saying, what's here, what's working, what's not, what assumptions should we take off the table.
And what were some of the, again, what was so interesting to us is some of the major system-wide improvements you all have prioritized. I know one has been around screening and assessment, and the other in terms of your software system.
So our sheriff's department, like I suppose many, corrections was sort of the afterthought child of the sheriff's department, and it was pretty much kind of a warehousing operation. It was all manual paper systems. We've invested in an electronic objective classification system to help us do initial screening, make housing decisions, an overall jail management system to then allow us to do further programming and assessment, as well as to issue a comprehensive RFP for medical services that we were able to write in that not only has to be physical health, but it has to be mental health, and we actually wrote in that a consistency of formulary. So when folks come into the jail who may be on mental health meds, we don't switch them to something different because it's 3 cents cheaper. So just, you learn a lot of little things like that, and then being able to have the right folks at the table, and again, being at the commissioner's office, because at some point, people come and say, doing this is going to cost more money. I work for a commissioner who says not doing it is going to cost more. Mm-hmm. And I think that's really important.
One of the things that's so interesting, I know it's easy to talk about a particular program or a training initiative or a tool. Everyone can kind of quickly wrap their heads around it. You all have talked about the personnel that need to be put in place to make sure everybody is actually screened. It's like a couple dozen or so staff, Mike? Was that
I think it's a total of about 20.
So 20 positions, right, that have to be put in place to actually do all the screening and assessment. We talked about recording this information. That's going to require a new information system.
Absolutely. The jail management system and the objective classification system, just the hardware and software, I think, is around $4 million. To give you an idea, we have 1.2 million people in the county. Average daily jail population hangs around 2,000, 2,200. So you can scale that up or down based on your county's needs. That was the upfront investment in computers and systems. The ongoing investment, like anything else, is
right.
in the people to run it.
Right. Now, I know one of the big things that we're really going to want to unpack here is, so you hear about the prioritization of strategies. Mike talked about the personnel to do the screening and assessments and the information system to support that. They did estimates about the costs of those things. The other issue, though, is really what funding streams are going to be tapped. And I think this is so important, really asking yourselves, to what extent can Medicaid, for example, really be tapped to cover some of these expenses?
And that was huge for us. We live in a Medicaid expansion state. Yes, we have a Republican governor and Medicaid expansion. Don't fall out of your chairs. We want to keep one and not the other, but that's okay. But Medicaid expansion only works, Mike, if people aren't sitting in the jail. If they're sitting in the jail, the Medicaid expansion doesn't make any difference because they're not Medicaid eligible when they're in custody. So having the Medicaid expansion is one thing, but having either a diversion mechanism or some sort of a pretrial screening mechanism that allows the judges to put people out on recognizance bonds or low enough bonds that they can actually get out of jail so that they're eligible for that coverage is critical.
And as a truly nonpartisan organization, both CSG and NACo, you'll make sure we hear the rejoinder to Mike Daniels' comments later on in the health services session. But thank you, Mike. But again, I think what we want to really plow through here is this can't be all county dollars, right, that are coming to the table. How are federal funding streams being drawn on? How are state block grants being drawn on? And then with whatever sort of remaining gaps, those precious few county dollars, how are those best allocated? This is something to be really unpacked during one of the breakout sessions. Let me turn to Liz Glazer. The mayor and his wife, the First Lady, have really made mental health a top priority for the city. And I know they've actually put resources behind that, Liz. Can you talk a little bit about what the overall mayor's initiative looks like? And then as the person who's charged with actually implementing it, how you're actually doing that from your position?
Sure. So we've had actually kind of two waves of interest and investment in mental health. The first was about a year and a half ago, where we put together pretty much everyone who touches the criminal justice and mental health systems, and went through a mapping exercise, really tried to sort of understand from soup to nuts what was going on and what was working and what was really not working, and then made some big investments in each point to try and bring all the system players together and kind of make a system a system. The mayor, not to be outdone, about 3 months ago, took the lens way back on mental health and looked at kind of mental health as it affects people in every walk of life, not just in contact with the criminal justice system, and has invested about $750 million over the next few years in looking at mental health in the schools, and maternal depression, in the violent mentally ill, and what do we do about interventions there. And these two things work very much together. And I think sort of one of the things I would say, and I think every speaker has touched on it, but I just sort of wanted to say it very explicitly, is I think this thing that we all kind of struggle with, or at least I know we do in New York, is that we talk about the criminal justice system or the health system, but these aren't really systems. They're sort of disjointed pieces that we're trying to hotwire together, and that problem is aggravated by the fact that there is no boss of the whole system. We have independently elected DAs and an independent judiciary, except for in the paradise of Connecticut, I understand. But, and so this notion, we can say all these things about sort of checking off our list of make sure your leadership is committed. I can barely get the word out. And go down sort of the list of 6 things, which I think are incredibly useful. But at the end of the day, how do you actually make people really want to solve the problem and feel it's their problem and not that other guy's? So I have a few things to say about that in case you ask me a question.
I do have some follow-up questions on that. I mean, first let me just go, Liz, to, again, resources put on the table. And I know one thing that you all flagged was, it was mentioned earlier, Sheriff Parmelo talked about diversion centers where police can take people. And I know that's something that you prioritized, you funded, and yet it doesn't even end with the funding of it. Can you talk a little bit about the challenges of actually rolling that out?
Yeah, so you think, if you build it, they will come, but first you have to build it, and that means actually getting somebody to want to do the thing, and you can put out lots of money, but if you don't have the skill sets out there or people who are willing to do it, you have to kind of rethink how you're going to do this right now. So that can sort of play out in a bunch of different ways. One is trying to kind of be a little flexible about how you're solving problems. So if the problem is to try and ensure that cops, when they encounter somebody who's mentally ill and really should not belong in a jail, that they have an option, or that a judge has an option, or a prosecutor, is the only way to do that is a bricks and mortar drop-off center? Or is there another way to do those kinds of things? So that's a sort of issue that we face every day, is how you actually implement the idea. It doesn't, and sometimes people have to kind of be pried away from the thing that they've wanted to do for 20 years, but maybe no one wants to build that thing or do that thing.
Yeah, Dr. Osher talks a lot about, okay, you've made the allocation of resources. Does that mean people actually have the skill set to provide all the services that you've just said that you want to pay for? Do the providers think you're actually paying a competitive rate for that? Are they actually willing to bid on it? I know, Tony, we've talked about actually taking these things to scale. You put out large RFPs, and lo and behold, no one can scale up that fast. Liz, from where you sit,
and there's one other thing. So, and this may be a high-class problem, but the question is, do you actually have enough people to do the thing you want to do? So we've gone very big in New York for what I guess I would call kind of the civilianization of this problem. It's not a cop problem, it's not a DA problem, it's a problem where social workers, clinical staff, and others could intervene. We are now at the point with our investments where I think we've maxed out the market in social workers. Literally, people aren't graduating fast enough and getting licensed fast enough for the number that we want to hire.
And we're competing for them. As we look at managed care, for instance, there are a lot of folks, case managers, social workers, clinicians, who are going into the managed care business, and they're getting paid much, much more than they are at our social services organizations. And so we're seeing that introductory turnover. I mean, the case manager or the caseworker is this person coming into the jail may have never been connected to services. We get them connected, and the first person they meet is that caseworker, arguably the most important person in the process. But if that turnover is happening every 90 or 120 days because we can't make the investment to pay those folks, they end up, it's a high-stress job, it takes a lot out of you, and if we're not taking care of our frontline case managers and social workers, and that turnover is high, then we have an uphill battle to climb with the best system implementation.
Ron, do you want to comment on that?
I think on a bigger level of what we're talking about here, you must include your behavioral health delivery system, however that is, and that's different everywhere. In Texas, we're not a managed care state. I mean, we're not a Medicaid expansion state. We're kind of fortunate in Dallas in that I'm also a commissioner's appointee to our local mental health authority, and I'm chair right now. We've had a system that's worked for a long time that the state is requiring us to break apart and do differently. And having all of the players, the providers, and your hospitals involved in this process has been critical. They were there from day one on the mapping and that, because you can get everything worked out on our end, and if you don't have the right handoffs out into the community where they are trained and aligned with what we're doing in criminal justice, it won't matter. Because I think we have all operated for many, many years on the concept that our problem is we're not making enough treatment available. And so you can begin to make the treatment available, but you may not get folks going there because it's not what they thought they needed or located where they're needed. And so often, the folks in the behavioral health treatment world don't understand all the complexities of someone in a criminal justice setting. And when you're in a program or a specialty court, you have to go through those supervision at the same time you're going through your recovery activities, and those don't always match. So it is critical you get not only your leadership, but your providers at the table from day one if you want to be successful.
Tony, I know one of the things you found in looking at Dallas County was, I believe, 20 spots where a police officer could potentially drop off someone with mental illness to process them through the justice system. For referral for mental health services, there were 2 spots that accepted adults, 1 that accepted youth. So You know, back to your point, Ron, about really making sure there's that partnership with the behavioral health community. Tony, to all the county commissioners in the room who keep hearing about the enthusiasm of all of their leaders in the justice and behavioral health system. They're putting together a project. They're setting up a new initiative. You know, we heard about LA and a big investment that's being made there. For those county commissioners, what do they track in order to see if things are actually having their impact that it's supposed to?
Well, first they need to want to track. So that's the first thing, you know, is the elevator going to go up or down or crash? And this is really important. So I think that's I don't know if we jump to the next question, but if you don't put a mechanism to track at least some of the major matrix here, the numbers, you will never know if the elevator went up or down or sideways. And it's really important, and that's something that I give credit to Ron and people in Bexar County, Mike Losito there, Commissioner Brooks in Tarrant County, were to their initiative, and this is an idea, I won't take credit for it. We got all the counties together to start measuring recidivism the same way across these 5 counties. Same definition, same set of data, same evaluation by risk. We already have 3-year recidivism for Dallas, about to finish Tarrant County, and by the end of the year, we'll have 3 different groups for 3 years, 1, 2, 3-year recidivism rates tracked in all these counties. And it's very eye-opening, because what is eye-opening is the recidivism rate has not changed much, you know? And what is very eye-opening, the 3-year recidivism rate is very high. What is really eye-opening is that after all this talk about evidence-based practices, if you look at the high-risk population that is supposed to be the target of evidence-based practices, the 3-year rearrest rate for those people are 55, 60, 65%, depending on the population, up as high as 77% for our state jail population. So this is going to trigger already a whole set of conversation at the county level. Why? Where is it that we need to pay attention? What are the programs that we're funding under the pretense that they're going to reduce recidivism, and can we track those to make sure that that is happening? And take it to that level. In terms of the buttons of the elevator, you need to have a matrix where you're constantly tracking if the plan is to connect the buttons for 1 to 1, 2 to 2, is that happening? And we are doing that now, for example, in Bexar County, trying to track how we have connected those buttons in the elevator. And when we look at the numbers, we know that there are some issues there. A big chunk of the population is not eligible for pretrial release, and that's an active fact not only of state law, but in great part of the local policies by the judges, that this population, and a lot of them are mentally ill, cannot be released on PR bond. They can be released on commercial bond with no treatment, but they cannot be released on PR bond.
So Tony, just
So
give an
we know
example.
the numbers, and we're looking at that to
Give
try
an
to
example
look
of
at it.
eligibility criteria where, you know, people think they've got a program, but then it turns out that half the people are excluded from it because they don't meet eligibility criteria. What's an example of a?
Right, it's eligibility and what I call attrition. So if you look at my buddy's story, guys, I warned you that I was going to do this, and I love them to that, and they will hate me after today. But take the March numbers that we're working, and again, I'll put it in the right context that we're looking at this to make it better, and they are committed to do it. In Bexar County, we screen about everybody coming into the system, about 4,000 people. 650 were potentially mentally ill. That's about 18%, which is right on the mark. But half of those are not eligible for pre-trial PR release, personal reconnaissance bond. And part of that eligibility issue is a local policy. So we're looking at that because right there you're excluding half of those. The other half then went to a full assessment, but there is a lot of attrition because the buttons in the elevators are not connected correctly. Sometimes there are no clinician because we have yet to put a 24/7 clinician there. So those people fall through the crack. Sometimes because of obsolete processes, they time out, they need to go to jail. so they did not do the full assessment. Sometimes they refuse. So out of the 295 people that were eligible for pretrial release, PR release, 144 were eligible for a full assessment, and a full assessment was done. And then 52 were submitted for the judge for a pretrial release decision. And again, there was a set of attrition there that we know what it is, and it has to do a lot with the processes. So at the end of the day, after all that, only 35 people got released on a mental health bond run that is required by state law. We have a state law in Texas for 22 years that require these processes to take place. And if you are not a nonviolent offender, if you're gonna get commercial bond, you should be released on a PR bond and connected to treatment. So out of the 650 people that were potentially mental health problems, 35 got released to a PR bond and connected to treatment. A bunch of them got released in commercial bond and never connected to treatment. And that's okay, right? Because the judges are now making decisions, so they go, it's not on me. They pay the fee and they get out. But they're not being connected to treatment, and they're gonna come back and loop around and loop around.
And
the point, not to pick on my good friends because they're doing a hell of a job trying to fix this elevator, is that if you don't have this in front of you constantly, and we look at these numbers monthly we're looking at these numbers, and we're trying to refine them because not all the systems are in place to generate the right numbers at the right timing. If you don't see that, and if you don't have the groups like they do to try to fix it, it will never get fixed. That is, I guarantee you, it will never get fixed.
And for someone now who's been working on this particular issue for 20 years, I can tell you this is still what gets me excited and want to work on these things. That we're now at this point where we've moved past particular tools, particular practices, particular programs, and you've got county leaders looking at the overall numbers and saying, at the end of the day, we thought we were going to serve hundreds, but we've ended up with a few dozen. What is going on with the system where we're ending up filtering out all these populations? What's happening? And really trying to drill down into that so that ultimately we can have a system-level impact. That's what this event is really looking at. We'll have one last question for Liz Glazer. Liz, you mentioned this isn't really a system. This is all these independent actors, who are somewhat interdependent, but at the end of the day still work pretty independently. Your charge is to try to get them kind of moving in the same direction. You've got a lot of counterparts in the audience. Any thoughts about what's effective in trying to really kind of harness that machinery and get it moving in the same direction?
So this will seem like a total setup, but it's the data. That is, if you can make the data not be an exercise in whose fault it is, which it can often be, like people keep one thing is just getting the data. Everybody's got the data, just everybody has it separately and they keep it like baseball cards that they may or may not trade with you. So if you can convince people that it's a safe place, that's the first thing. Actually, people have never actually looked across the system panoptically. And so they don't know. It's not just that, oh, it's that guy's fault. If they can see it all at once from kind of A to Z, it actually becomes a diagnostic, and data ends up, I think, being the glue and the problem-solving tool.
That was a perfect setup. Thank you, Liz.
My pleasure.
I think now we go back to our safe space at the tables, and we're going to go and we're going to address these last three questions. And again, I'm going to ask you to pull out your phones and do a little bit of polling, and then we're going to ask you to talk for a few minutes. We're going to give you the poll results, and then we're going to move on to lunch. So if I can pull up question 4. point, so you got the applause.
And one of the things going through our exercise was when we didn't have direct access to data, we had some pretty good mechanisms for approximation.
So when Okay, can I get your attention one more time, please? Of you saying working on this but still have a ways to go. Question number 4, have you done that really comprehensive process analysis and inventory of services? Again, about 100 of you, this is saying that you still have a ways to go on that one. 2 last questions. And I think these are the hardest ones, prioritizing practice and funding improvements. This is where nearly everybody says they have a ways to go. And then lastly, in terms of tracking progress, I thought that that panel was so helpful in terms of how are we going to know what kind of impact we're having if we're not tracking progress. That's going to bring everybody together. Lots of you saying you don't have that data yet in place. That needs to be a priority. Well, I think that sets the stage well for our afternoon sessions, right? Lots of work to do, but the good news is that we have lots of smart people in this room, lots of inspiring things happening in different jurisdictions across the country, and the breakout sessions are organized according to each of those questions. So you'll have time to really send different team members 2 different questions. I hope that you'll divide yourselves as county teams and spread yourself up across the different questions. And then, not yet, just 2 more minutes, please. You'll also notice that at the end we have this afternoon time for you to interact with your peers. So you have a session that's organized for you to meet with judges or court officials or jail administrators or rural jurisdictions. So that's an opportunity for you to network with people who share your perspective. One of the things I really want to thank APAF for is the ability to not only provide you lunch, but we all go to lunches where then we have to sit through 4 more luncheon speakers. Not today. You actually get time to spend among your teams. There's a box lunch that's outside, and you can grab your box lunch, and hopefully you'll use it to spend more time with your team, keep talking about these issues. And then at 1:30, we need you to make sure you're in your breakout room. So about 1:15, lunch ends, and would like to see you in the breakout rooms at 1:30. All the directions should be in your conference materials. It's been a great morning. Really looking forward to this afternoon, this evening, and tomorrow. Thank you all very much.